The sha shi point is on the outside of the dorsum of the foot, at the head of the seam where the fourth and fifth fingers connect. To stimulate the sha shi point, you can use the method of massaging and press it with the pulp of the thumb. Sha shi point is suitable for points with soreness, and then centering on sha shi point. Maintaining a certain degree of strength, rotate and massage for 5 to 10 minutes on each side. Massage once a day in the morning and evening, and can also use pinch massage. The method is to press and pinch the position of the sha shi point with the thumb of the hand. The force can be slightly heavier. If it is slightly painful, keep it for 5 to 6 seconds, then release it. The sha shi point can be pinched for 3 to 5 minutes, or you can use the end of a ballpoint pen, a cotton swab or a few toothpicks upside down, tie it with a rubber band, and then use the blunt ends of these items to continuously stab the position of the sha shi point. This method can achieve a similar effect to acupuncture and stimulate the sha shi point. You can also use the point pressure method in scraping. Hold the scraping board, and place the thick corner of the scraping board with the skin at the sha shi point at a 90-degree angle. Press down. Gradually increase the strength, as long as you can tolerate it. Keep it for a few seconds and then center of the chest, on the midline of the sternum. Look for the shan zhang point in the space between the fourth rib. This is the fourth rib. This is the midline of the sternum, and this is the shan zhang point. Now, clinical trials have also found that stimulating shan zhang point can dilate blood vessels and adjust heart function. When massaging, you can press shan zhang point with your thumb and feel the local soreness and pain. That is, press the right point and press the point with your fingers. Hold for a while. Then release. Press and release for a cycle. Massage shan zhang point 300 times at a time, or press and knead the shan zhang point with the thumb. The U point feels sore and painful locally. Keep a certain amount. Press the pressure. Use the thumb to do rotary massage on shan zhang point, clockwise and counterclockwise for 300 times. In modern life, due to the tense life rhythm, irregular life, often staying up late, young people suffer from angina pectoris, the chances are getting higher and higher at this time. You can also use massage the altar point as a healthcare measure. Sitting position. Bend the knees. Ask others to press their palms on the knees. And aim at the top of the kneecap. The method is to press and hold the position of the shui high point with the thumb. Gradually press hard and deeply. Hold for 10 seconds, then release for 5 seconds. One press and one release is a cycle. Generally press for 3 to 5 minutes, or massage can also be used. The method is to use the pulp of the thumb to press on the shui high point. With the point as the center, maintain a certain strength to rotate and massage. The strength is suitable for a feeling of soreness, each massage for 3 to 5 minutes. Also suitable for stimulating the shui high point, gentle moxibustion. Hold the ignited moxa stick, about 2 to 3 centimeters away from the shui high point. Use the method of clockwise rotation from the inside to the outside, 10 to 15 minutes each time. Pay attention to the local points. The skin can be stopped when there is a red army. The bird pecks and burns, and the ignited moxa sticks are aimed at the shui high point. The method is cupping. This method is particularly effective for the shui high point. Generally tank opened after 10 to 15 minutes, however, it is worth noting that the operation method of cupping is too professional. Generally speaking, it is not recommended to do it yourself. The method of scraping can also stimulate the shui high point. After dipping in the scraping oil, hold the scraping board with the shui high point as the center. Repeat the one-way scraping from top to bottom along the meridian direction. Pay attention to scraping. The thin edge of the board should be aligned with the palm. The thick edge is the focal point. The wrist and arm should be relaxed, and the force should be continuous and even. Subject to personal tolerance, scrape for 3 to 5 minutes, and it is advisable. with your thumb along the inner edge of the tibia of the calf, and push up from the bottom and the inner side. You will feel a sunken place, which is Yin Ling Quan point. To stimulate Yin Ling Quan point, you can use massage method. Press the pulp of your thumb on the position of Yin Ling Quan point, and then take the point as the center. Keep a certain strength for rotating massage. The pressure is suitable for the feeling of soreness and heat, each massage for 3 to 5 minutes. Insist on regular massage every day. Moxibustion is also suitable for stimulating Yin Ling Quan point. You can use mild. The method of moxibustion is to ignite the moxa stick, and the ignited end is about 2 to 3 centimeters away from the skin at the Yin Ling Quan point. The method of clockwise rotation is used from the inside to the outside, and the moxa stick is burned for 10 to 20 minutes each time. It can be stopped when there is a flush. You can also use the bird to peck and burn. Aim the ignited moxa sticks at the Yin Ling Quan point, and use the technique of falling near and far together, just like a bird pecking, which can give the point a good effect. For stronger warm stimulation, the method of blood pricking can also be used. After the skin is disinfected, pinch the skin at Yin Ling Quan point with the index finger and thumb, and quickly prick the skin with a needle a few times to make it bleed, and squeeze out 3 to 5 drops of Ting Gong point is located in front of the ear, behind the condyle of the mandible. When taking the point, you can sit or lie down, open your mouth, and touch the front of the tragus with your hand in the direction of the flat ear bead. You will feel a sunken place. Here is the Ting Gong point. To stimulate the Ting Gong point, you can use the method of tapping. Press the index finger of both hands on the position of the Ting Gong point, press it with a certain force for 3 seconds and release it. Press and release for a cycle. Press 30 times in a row, once in the morning and once in the evening. Press regularly. You can also use the method of massage. Put the index finger and the pulp of your hand on the position of Ting Gong point. Keep the position as the center, maintain a certain strength, and perform gentle circular motions. 3 to 5 minutes each time or 100 circles, 1 to 2 times a day. You can also use the rubbing method. Rub the index and middle fingers from bottom to top Ting Gong point and its surroundings. Rub continuously for 36 times, then change hands and rub the other side of Ting Gong point, once a day in the morning and evening. First, find the location of Ne Guan point. Ne Guan point is located on the volar side of the forearm of the human body. From the center of the transverse wrinkle near the wrist to a position about the width of 2 thumbs upwards, to stimulate the Ne Guan point. You can use the pressing method to use the pulp of the thumb. Press and hold the Ne Guan point. Massage the finger pulp and press hard. Keep the intensity for 5 to 10 seconds. Then relax and press again, 10 minutes each time, 5 times a day, 15 days as a course of treatment. To stimulate the Ne Guan point, can use the massage method. Press the acupuncture point with your thumb, and then take the acupuncture point as the center. Maintain a certain strength, rotate and massage from the inside to the outside. Each time can be massaged for 3 to 5 minutes, twice a day. You can also use the finger pinch method to stimulate the inner Ne Guan point. Pinch the point with the thumb and fingertip. Pinch slowly and firmly. Press deeply for 3 seconds and press lightly for 3 seconds. Each time lasts for 5 minutes. You can also use moxibustion to stimulate the Ne Guan point. Ignite the moxa stick Ne Guan point about 2 to 3 centimeters away from the surface of the skin, to the extent that the skin feels mild but without burning pain. Moxa burn for about 10 minutes each time. As long as the skin at the point is flushed, once a day before going to bed, 3 times a week. After 5 times, find the position of Shin Shu point. Shin Shu point is located 1.5 inches next to the spinous process of the 5th thoracic vertebra. It is this point to stimulate Shin Shu point. The same pressing method and massage method as Ne Guan point can be used. Regular stimulation can achieve good results. Tian Chuang point is located on the outer side of the neck. When looking for this point, we must first find the position of the sternocleidomastoid muscle. Tian Chuang point is just behind the sternocleidomastoid muscle parallel to the Adam's apple. To stimulate the Tian Chuang point, we can use the method of pressing. When pressing the point, straighten the neck, and then place the pulp of the thumb on the Tian Chuang point. Press down 5 times with a certain force. Do it 5 times in a row, and then switch to the other hand. It should be noted that the pressing, it must be gentle and slow, because there is a carotid sinus nearby. If the force is too large, it will affect the heart rate and blood pressure, and even cause the danger of fainting. The position of the acupuncture point and its surroundings, and then with the point as the center, keep a certain strength and gently rotate and massage. C-man point is located in the abdomen. When taking points, lie down, measure 3 horizontal fingers, 2 inch from the navel downward, and then open the half horizontal donation on the left and right sides. To stimulate the C-man point, you can use the method of pressing at this point. Press the pulp of the thumb on the C-man point, and there will usually be a sense of soreness and swelling. Gradually press firmly and deeply. Hold for 5 to 10 seconds and then release it. Press and release for a cycle. Press the C-man point 5 to 10 minutes, or you can use the massage method. Place your thumb on the C-man point. Take the C-man point as the center. Maintain a certain strength. Rotate and massage clockwise, and press and knead the C-man point 5 to 10 minutes. You can also use the method of moxibustion. You can use gentle moxibustion. After burning the moxa sticks, aim at the C-man point about 2 to 3 centimeters from the surface of the skin at the point. It is suitable for burning pain. Moxa burn for 10 to 15 minutes each time. You can also use the bird peck. Ignite the moxa sticks and then aim at the C-man points, and use the technique of scorching all the way, usually 10 minutes each time, by about 15 minutes. The skin is warm and flushed. The location of Mu Chuang point is easy to find. We must first find the Shen Ting point and two-way point. Two-way point is in the hairline on the side of the head. The point of the finger is Shen Ting point. The midpoint of the line connecting Shen Ting point and two-way point is Tu Lin Shi point. The method of pressing is to use the thumb pulp to press on the Mu Chuang point. At this time, you can feel the local soreness and pain of the point. Press the point with your fingers. Apply a certain force, and gradually press deeply and continuously for 2 to 3 minutes. Use the method of massage to stimulate the Mu Chuang point. Press the position of the Mu Chuang point with the pulp of the thumb, and then take the point as the center. Maintain a certain strength, gently rotate and press. And rotate 100 times clockwise each time. You can also use the roots of the palms on both sides to press the Mu Chuang point, and then slowly knead, 2 to 3 times a day. Insist on regular massage. First find the Sanyin Jiao point. Take the supine position. Sanyin Jiao point is on the inner side of the calf, when the inner ankle tip of the foot is 4 inches. The Sanyin Jiao point can be stimulated by pressing. Press the Sanyin Jiao point with the thumb pulp for 5 to 10 seconds. Then relax, and then press. Keep repeating 10 minutes each time. 15 days is a course of treatment. Then find the Hang Jian point, it between the first and second toes, at the back of the edge of the web of the toes, at the margin of red and white flesh. To stimulate the Hang Jian point, you can use moxa. Ignite the moxa sticks and place them in the correct position, about 2 to 3 centimeters away from the skin surface. To the extent that the skin feels mild but without burning pain, each time the moxa sticks are burned for about 10 minutes. Also stimulate the interline points, can use the pressing method. Pi general point is located at the waist. The prone position is used for point selection. The line connecting the iliac crests on both sides, the intersection with the spine, is the third lumbar vertebra. The 2 upward vertebrae are the first lumbar vertebra, and the lower edge of the first lumbar spinous process opens next to the lower edge of the first lumbar vertebra. It is at the 4 horizontal fingers. To stimulate the pi general point, you can use the tap method. Place the thumb pulp on the pi general point, press down hard, hold for 5 to 6 seconds and then release. Rest for 3 seconds before pressing. 1 pressing and 1 loosening is a cycle. Press the pi general point for 5 to 10 minutes each time. You can also use the massage method to stimulate the pi general point. Press the thumb on the pi general point and proceed in a clockwise direction. Rotate and massage for 5 to 10 minutes each time. Moxa burning method can also stimulate the pi general point. Place the ignited moxa sticks above the pi general point about 2 to 3 centimeters from the surface of the skin, and use the skin at the point. It is appropriate to feel mild but without burning pain. Moxa is burned for 10 to 15 minutes each time. You can also use bird pecking and burning. Point the ignited moxa sticks at the ruffian root point. And use the technique of falling together and moving near and far, just like a bird pecking. It is usually 10 to 15 minutes per treatment. And cupping can also be used to stimulate the ruffian root point. Place the lit cupping at the point, and leave the pot for 10 to 15 minutes each time. Up to the degree of tolerance of the skin bulge at the cupping site, the above operation methods can be used alone or in combination. Dahi point is located in the abdomen, 6 horizontal fingers or inches below the navel, and 4 horizontal fingers on the left and right sides, to stimulate the Dahi point. You can use the method of tapping. Press the thumb pulp on the Dahi point, and gradually apply more force. Hold for 5 to 6 seconds and then release. Press and release for a cycle. Press the Dahi point for 5 to 10 minutes. You can also use the method of massage to stimulate the Dahi point. Press the thumb on the Dahi point. You can feel the soreness and swelling at the point. And then take the point as the center. Maintain a certain strength to rotate and massage. First massage clockwise, then counterclockwise, each time for 5 to 10 minutes. You can also use the rubbing method to stimulate the Dahi point. Stack the palm of the left hand on the right arm. Gently place the palm of the right hand on the position of the Dahi point on the lower abdomen, and do clockwise and counterclockwise circular rubbing with appropriate force, for 3 to 5 minutes. Preferably the abdomen is hot. Gentle moxibustion can also stimulate the Dahi point. Point the ignited moxa stick at the Dahi point about 2 to 3 centimeters from the skin surface at the point. Moxibustion for 10 to 15 minutes. You can also use the bird pecking and burning to point the ignited moxa sticks at the Dahi point, and use the method of falling near and far to perform moxibustion. Generally, moxa is burned for about 10 to 15 minutes each time, and cupping can also stimulate the moxibustion. Dahi point. Place the lit cupping pot at the acupuncture point. Leave the pot for 10 to 15 minutes each time, until the skin at the cupping site bulges to a degree that can be tolerated. Jin Suo point is located on the back, when the posterior midline is on the posterior midline, the line connecting the lower angles of the scapulae on both sides when the hands hang down. The intersection with the posterior midline is the 7th thoracic vertebra. Push down the depressions on the lower edges of the two cones to stimulate stimulation. The method of pressing the Jin Suo point can be used. Press the thumb on the Jin Suo point and gradually press it hard. Hold for 5 to 6 seconds, then release it, rest for 3 seconds. And then press it again. Press the Jin Suo point for 5 to 10 minutes. You can also use the massage method to stimulate the Jin Suo point. Use the thumb pulp to press on the Jin Suo point. And perform rotary massage with the point as the center. Press for 5 to 10 minutes each time. The method of gentle moxibustion is also suitable for stimulating the Jin Suo point. After burning the moxa stick, aim it at the Jin Suo point about 2 to 3 centimeters from the surface of the skin at the point, burning for 10 to 15 minutes. You can also use the bird to peck and burn. Hold the ignited moxa stick in your hand, aim at the Jin Suo point, and apply the burn in a near and far away together. Generally, the moxa burn is about 10 to 15 minutes each time. Warm flushing is a degree. You can also use the method of cupping. Leave the pot for 10 to 15 minutes each time. You can start the pot, but in order to avoid danger. The method of cupping is still recommended to go to a professional medical institution. Improper, causing burns or scalds. The above operation methods can be used alone or in combination. Shizan point is located at the tip of the index finger of the hand, 0.1 inch away from the edge of the nail polish. There are 10 points on the left and right hands. The best way to stimulate the Shizan point is to puncture and let blood, sterilize the needle of the syringe, then sterilize the patient's fingers with alcohol cotton balls. Pinch the patient's thumb and fingertips to expose the Shizan point, and quickly pierce the point with the needle to make 3 to 5 drops of bleeding at the point. Squeeze it to make it bleed. Dry it with a sterile cotton wool, press it to stop the bleeding, and then puncture the Shizan point on the rest of the fingers. Stop immediately after the convulsion is controlled. You can also use the method of pinching and pressing, using the fingernail of the thumb, and repeating the pressure repeatedly. Pinch Shizan point, preferably if there is soreness. No more than 5 minutes each time, or you can bring a toothpick over and use its rounded tip to puncture Shizan point continuously for about 3 to 5 minutes, depending on personal feeling. To increase the time, the above operation methods can be used alone or in combination. Xiao Chong Shu points are located in the sacrum. The prone position is used for point selection. The medial border of the posterior superior iliac spine is first palpated, and the first posterior sacral foramen is between the midline of the dorsal spine and 2 transverse fingers, and the Xiao Chong Shu point is 1.5 inches away. For the Xiao Chong Shu point, we can use the method of tapping to stimulate the Xiao Chong Shu point with the pulp of the thumb. Press the position of the Xiao Chong Shu point, press down with a certain force. Keep it for 5 to 6 seconds and then release it. Press the Xiao Chong Shu point for 5 to 10 minutes to stimulate the Xiao Chong Shu point. You can also use the massage method to press this point with the thumb pulp. Rotate and massage in a clockwise direction for 10 to 15 minutes each time. You can also use point tapping or slapping methods to stimulate Xiao Chong Shu points. Hold both hands into hollow fists, and continuously tap Xiao Chong Shu points for 50 to 60 times. Second, When patting, bend the 5 fingers slightly together, and tap the Xiao Chong Shu point alternately with both hands for 5 to 10 minutes on each side each time. Pangguang Shu point is located in the sacrum. The medial border of the posterior superior iliac spine should be found first when selecting the point. Between it and the midline of the dorsal spine is the first posterior sacral foramen. The cone is the second sacral vertebra, which is 1.5 inches away from the 2 transverse fingers. For the point selection, you can use the method of tapping to stimulate the Pangguang Shu point. Press the thumb on the position of the Pangguang Shu point, press down hard. Release it after 5 to 6 seconds, rest for 2 to 3 seconds, and then press again. 1 press and 1 release is a cycle. Press the Pangguang Shu point for 5 to 10 minutes each time. To stimulate the Pangguang Shu point, massage can also be used. The method is to press the Pangguang Shu point with the pulp of the thumb, with the point as the center, maintain a certain force. Rotate and massage in a clockwise direction, and press and knead for 5 to 10 minutes each time to stimulate this point. The method of moxibustion is to ignite the moxa sticks and compare the Pangguang Shu point about 2 to 3 centimeters away from the skin surface to perform moxibustion. It is advisable that the skin at the points feels mild but there is no burning sensation. Moxa is applied for 10 to 15 minutes each time to stimulate the Pangguang Shu point. The cupping method can also be used for the Pangguang Shu point. This method is particularly effective for stimulating the point of the bladder, generally. The tank can be removed after 10 to 15 minutes.
す。